Welcome to our Back to School Supporting Our Mental Health Facebook Live. I'm Doreen Marshall, Vice President of Mission Engagement at the American Foundation for Suicide Prevention. And today I'm really excited to be joined by panelists who are going to have a conversation about mental health. We know that with back to school season comes lots of different things. I know as a parent, this is a time where we're both excited, but also experiencing some stressors related to changes coming back to school. And I know as someone who also works as a mental health professional, it's really important that we support our school staff, our parents, and certainly our students as we return back to school. So with that, I want to welcome our panelists joining us today from the American School Counselor Association and the National Parent Teacher Association. We have Jill Cook. Jill is the Executive Director for the American School Counselor Association. We have Alma Lopez, who is the 2022 School Counselor of the Year and also the lead school counselor at California's Livingston Middle School. And we have Shaitan Berry, who is the National Parent Teacher Association, PTA board member and Healthy Minds ambassador. So glad to have all of you with us. To get us started, we've had a really interesting couple of years and we're headed back to school now. And there's been so many reports, since the pandemic about mental health in our young people. Certainly the teachers and parents that I've talked to, everybody is kind of feeling and paying more attention to their mental health right now. What should we be thinking about in terms of going back to school and our mental health? What have you heard? What's top of mind for the three of you? Jill, why don't we start with you?
Sure. So, one of the things that would be top of mind for me is that schools hopefully are going to come into this school year with the staffing that's necessary to support those students. We want to make sure that all students have access to a school counselor, a school social worker, a school psychologist, a school nurse. But we do know that that's just not the case in a lot of places. Because students spend 8 hours or more a day at school, and we can talk more about this later, but often it's these educators, these folks who are in the school, who are sometimes the first to notice when students are having issues that might warrant more help. So for me, it's ensuring that we have those school positions to help students and to work with staff and families.
So true. Shaitan, what are you thinking we need to keep top of mind for this conversation?
I think that, this school year is going to bring a lot of new, right? It's going to bring new morning routines, new after school activities, new classmates, teachers, and students, new homework to worry about. And so how are we going to prioritize the mental health for not only our students, but our teachers as well as our parents? So I think the big thing is, keeping those lines of communication open. Being able to have those conversations. And one of the things that I always tell parents is stop asking, what did you learn in school today when they first get in the car, but ask, how did you feel in school today? Let's start normalizing conversations about feelings and how we feel, so that our children know that they are safe with you as an adult, is safe with you as a parent, that they can express their feelings, because when we don't acknowledge feelings, they become bigger things. They turn into bigger issues. And so if we can just normalize that going into this school year, I think it will help all of us. And parents, normalize your feelings, acknowledge how you feel. Teachers and everybody needs to acknowledge their feelings so that we can really work together as we move forward, talking about mental health.
It's such a great point. I was talking with my kids this week who are headed back to school, and I was sharing with them that I'm a little sad the summer's ended for them too. We had a nice summer together, and I was feeling some of that too. But I think you're right, kind of normalizing and really, being aware of our own feelings as adults and parents around going back to school. Alma, what would you add? I know you're in the schools as school counselor. What do you think we should be keeping top of mind as we go back to school?
Yeah, absolutely. I couldn't agree with all of you more, right? Definitely making sure that the staffing is in place is going to be something that is going to be helpful for all schools. So making sure that, that funding is getting to where it needs to get to, number one. Number two, normalizing things as best as we can, right? And so when I really think about what's needed, I stop and think about the fact that we all have had this long-term collective trauma together, right? Our students, our caregivers, our staff. The first year, we were all in shock. There was so much unexpected with our school closures and with really the world shutting down. And then the second year, we remained in this state of uncertainty as we were unsure about the masks and the vaccines. And do we get together? And some of us returned to the building and some of us didn't. And what about making friends and resolving problems? And so this year, as we're returning, is really an opportunity for us to create spaces for all of our stakeholders, our students, our staff, our parents, to really reconnect with one another and to bring some of that fun back to schools in a way that's safe. So bringing back movie nights or carnivals and things like that that the schools were known for, but bringing them back in the safest manner so that that feeling of fear is acknowledged, right? We acknowledge there's a little bit of fear coming back to some of those things, but together we can do that. And so I think for schools, really trying to create a space for all of us to rebuild our relationships after this long-term collective trauma is really going to be important.
Yeah, these are really important points. And I know in the parent groups that I've been in, we've been talking a lot about kind of like how to support each other as we go back to school, but also recognizing that, each year has been different of the last few. And so, when you think about kind of the parents that you interact with or that you're around, I mean, what advice would you give them about like how to best support your kids these days? I know what I've been saying is, keep the dialogue open, to ask the deeper questions. I always tell my parent friends, like, ask your kids about their friends too, because sometimes that's an entryway in. Like, who of your friends are you worried about? Who seems to be having a hard transition back? Those kinds of things often open up the door for dialogue with your own child as well, in addition to the fact that we should be all gatekeepers for the kids around us. So I'm wondering, maybe Alma, we start with you. What are you telling parents? What advice would you give them around supporting kids as they go back to school?
Sure, absolutely. I think my advice has been and will continue to be, parents are the experts in their child's life. And they always have been, and that continues to be the case. And as educators, we're an important part, right? You send your kids to our schools for a big amount of their time. And so we as educators and we as parents need to make sure that we have that structure and routine that's so important for young people as they're developing. We need to have that. But we also really need to have grace and patience. And it's so important that we recognize that important role that we play as adults in these young people's lives, right? These kids are going to become adults, and we want them to thrive right now in their developmental years, that we can all look back and remember, really many of us have, well, all of us, right? We've not experienced the COVID shutdown and all of those things. And so really our kids have also had this traumatic experience. So being able to talk about it is going to become very important. And that's always been important. But being active, like you mentioned, in young people's lives, caring about the young person, their friends, and about their interests, and then knowing that we can, as adults, guide them through this difficult time. And lastly, I would say always just allowing the young person to be who they are, to be their authentic self, will continue to be important as we help them get through this time together.
So great. Shaitan, I know you've had some thoughts about this from PTA. I know you're talking with lots of parents these days. What advice are you giving them?
I mean, Alma gave some great advice. I would say be aware. know what's going on in your child's life, know what they're going through socially, academically, emotionally, and physically, right? Like, get involved with those things, ask those questions, see how they are, and then talk openly with your child. I think it's very important for us as adults to, whether we know it or not, we demonstrate mental health. We show our kids how to adapt to mental health. We show them how to adapt to stress. And so whether or not you're doing it great or not, it all depends, right? But I think it's okay to come home and say, oh my God, I had a really stressful day. How was your day? Because I was pretty stressed. I think like having those conversations to make it normal to say, hey, we all have these stresses. You have stress. Let's talk about it. Maybe let's go get an ice cream cone, or maybe we walk, or, do some of those things together. But let's normalize having those conversations, right? And then I think prioritizing a healthy lifestyle, because we know that if we can get out and walk, that improves our mental health. Exercise improves our mental health. Just being active in that way. And so how do we make sure that we're doing that, not just as individually as a child, but as a family? How do we make this important? And then I think the biggest thing that parents need to do this school year is speak up for your child. When your child is struggling, when you see something going on, speak up. When your child sees you as that advocate, when they see you as that voice, then they're okay with saying, yes, mom, this is what's going on. Yes, dad, this is what's happening. Uncle, aunt, whomever that adult is in their life. I think that's what they need to see. They need to see real life examples of you dealing with stress, with you having feelings, and they need to see you speaking up for them so that they know that it's okay for them to speak up for themselves as well.
I mean, both of you are making such important points, and one of the things I know we talk a lot about at AFSP is this idea that, like, we are always modeling taking care of our mental health. And as we know, our children they watch everything, and they know, take their messages not only from what we're saying, but from what we're doing. And so if we're, running ourselves ragged, or we're overscheduled, or, they tend to take away some messages about, whether that's valued, whether that's an okay way of coping. And so, maybe the first thing we can do is kind of all take our own temperature around our own stress going back to school, how we're taking care of our mental health, how much we're escaping, right? Whether it's, escaping, watching lots of Netflix, which all of this is healthy at times, right? But whether we're doing it to the point where it's making it hard to kind of get through our day-to-day work, or using substances, they're watching us. So we want to send them good messages around how we take care of our mental health. And the other thing, I often say to parents is you can always go back. So if you do this badly, one of the best things you can do is say, you know what, I had a really stressful day at work yesterday, and I wasn't my best self with you. And today's going to be better. I'm going to do better, to go back to our kids, because a lot of times I don't think they know that we may, in private, we regret the thing we said, or the time we may have gotten angry and didn't mean to. We can always go back, and that's watching us do that, like you're saying, Shaitan, is really important. Watching us be an advocate, watching us cope in real time, that can be really important lessons for them to learn as well. Jill, what would you add?
So I really love the notion of grace and patience as we think about this. That's sort of been one of my mantras over the last year or two, is grace. Just grace with everything. And I think that's an important concept to share with students and families. And I would also want parents to know who individuals are at the school who can help with that advocacy, who could help if they have concerns about their students. I'd love to think that every parent and every family member knows who the school counselor is in their school, or the social worker, or the school psychologist. But I think it's really important that schools communicate with families and parents about who the school personnel are and what they do and how they can support their students. And for Alma knows this all too well, our school counselor's role has really shifted over the last 20 to 25 years. We're not the guidance counselors who just work on getting students into college or work on disciplinary efforts. School counselors today work with all students in a school around academics, careers, and that social and emotional development. So really ensuring that families know where to go and who they can talk to when they do have concerns.
Excellent points. These are all such important things for us to remember as we go back to school. And, you know, the other piece that occurred to me, Jill, as you were talking, is that how important it is for us to recognize that while we're all going back to school, we may not all have the same experience of going back to school.
Mhm.
So, you know, there's some that are looking forward to it, some who may not be, some who had real challenges over the last couple of years. And so just a recognition of that this, you know, there's no one size fits all, I guess, and getting to know the counselors and the staff at the school who can really support parents in advocating for their children. So I know, you know, and for those of you that may be just joining us, we have Jill Cook, who's the Executive Director for the American School Counselor Association, Chetan Berry, who is board member and Healthy Minds Ambassador for National Parent Teacher Association, PTA, and Alma Lopez, who's the ASCA School Counselor of the Year and the lead school counselor at California's Livingston Middle School. So I know all of you are with organizations, and Alma, you're in the school. Tell us about some initiatives or things that you've been doing with your organizations to help support school staff and the mental health of students as we head back. And if you have any examples of them, I know our audience always loves to hear those kind of real life examples. Chetan, do you want to start talking a little bit about PTA's work with the Healthy Minds?
Sure. I mean, we've done a lot of work over the past 2 years. We did a lot of work with COVID relief, and our PTAs really stepped up to provide supplies, the PPP supplies that parents may need. And they had vaccine clinics to make sure that we can try to get our kids vaccinated. And then they had some ideas. There was a school, Bonneville Elementary School PTA in Utah. They worked with their school's social emotional support team to transform a former kindergarten classroom into an inviting therapeutic space that was distinct for the academic setting. It was a wellness room in which students could take a break during the school day when they feel stressed or overwhelmed, a place to process and connect. So a lot of our PTAs are really focusing on wellness and mental health, not just for the students, but for the staff as well, making sure that they have those things, adding resources rooms so that parents can find materials to help them manage their mental health in the home and in the community. And that's one of the beautiful things about the Healthy Minds program is that it's really focused on family. It's focused on how families can work with with the members of their family to focus on mental health. So it's not the school trying to force families to talk about mental health. It's really the families taking the ownership to say, hey, we need to have these conversations about mental health. And so those are some of the initiatives and things that are being done by PTAs across the country.
Oh, and I love that so much, the idea of the wellness rooms. One of the things that was really, and I've heard that just anecdotally across the country that many schools are doing. And early on in the pandemic, one of the things I loved that schools and districts did was create sort of virtual wellness spaces that had art and music and mindfulness, but just really acknowledging what you said, Chetan, about that we need an intentional space to do that work.
Mm-hmm.
It's fabulous. I just came back from a conference where there was kind of an art room for people to drop in throughout the conference, and it was with a specific intention, but it was so relaxing to just kind of come in the room and make something. And I think sometimes we forget throughout the school day how restorative those breaks and those moments can be. So I love that initiative. Jill, I know your constituent group, school counselors. Tell me what ASCA's been doing just to support them, not only this year, but over the last several years.
Wow, so much. But I will say, Doreen, what you made me think about, we just came back from our annual conference in Austin, Texas. And one of the things we did at one of our events is we had an art wall. We had an artist, a local Austin artist, and he invited people to come participate in this mural he was painting that has been since donated. But yes, just, I mean, things like that, that adults put on their smocks and were painting and drawing, and how much that supported their work. So for ASCA, our goal is to support school counselors across the country. So we do that primarily through our professional development offering. So again, our annual conference we just had, I would say at least 25% of the sessions we offered to the more than 5,000 school counselors there had to do with mental health, mental wellness in some way, shape, or form, because those are the session proposals we received, because that is what school counselors are seeing, hearing, and needing. We as an association offer online webinars, and we have a series of specialist trainings that are self-paced, self-guided, professional learning opportunities, and we have one specifically on student mental health, and have since created a position statement specifically on the school counselor's role in student mental health, because school counselors don't provide therapy. They don't do long-term therapy. Their goal is to work with all students and may do short-term counseling. So some of what we do is education materials, so school staff and parents do understand the appropriate role in this work, in this space. And our next issue of our magazine that comes out will be all about student mental health. All the articles will focus on that in some way, because again, this is what we keep hearing from our members and school counselors in terms of what they're seeing and what they need.
Yeah. I mean, it's so important, everything that both of you said around kind of trying to think about these things before you're in a mental health crisis, right? So this is a good time for parents to kind of learn who the school counselors are, right? To get connected with their PTA and other groups at the school who are focused on supporting mental health, to learn about resources in the area. Like, we don't want to wait. One of the things at AFSP we've spent a lot of time focused on advocating for is the new 988 number, which is the 3-digit number to access mental health crisis support. It's a shortened version of the National Suicide Prevention Lifeline, where people can dial 988 and get connected into that system. And so the idea is for us to all be kind of learning about the resources that are out there to support us, and the people who are in the schools who are there to support us, long before we have a situation where, we're scrambling then to figure out what can we do. Alma, I'm curious, you're in the school. I'd love to hear what you and your school have been doing to support mental health.
Sure, absolutely. It's many of the things that you just mentioned. So I was thinking, oh yeah, we did do a virtual calming room, and it was really well received by all stakeholders when it was needed. And we've actually still continued it, because we do know, right? School is 8 to 3:30 maybe, or something like that, right? But a lot of times things happen outside of the school day. And so making sure that our students know about that opportunity is really important. So we even created like a QR code on a little flyer. And before every holiday break, we make sure we push that out to all of our students, and really to all of our community. So some of the things that we've been able to do is just really look at what we were doing already, because we had the staffing, right? And how do we enhance it to be what is needed right now? What are our parents telling us they need? What are the students saying that they need? And so through that, one of the things we've always done in our district is had these monthly awareness campaigns. And so we started to be a little bit more intentional about them. So for example, we know September is suicide prevention awareness. And so we looked at, okay, how do we get information, right? Education into the hands of all of our stakeholders. And so we create a flyer that has information for our caregiver community, for our student community, for our staff community. And then we highlight those throughout the month. So we might sit in a staff meeting with teachers and say, hey, here's some of these resources that you can do with your students in the classroom. And then we hold workshops for parents that month too and say, hey, here are some videos or some links to some things that you can help have conversations with your child. And then with our students, we actually do a couple of things. One of the things that I love doing is we spend a whole week, that awareness week, kind of having activities for them during lunchtime. Sometimes it's a table with information that they could just pick up and take home. And sometimes it's an activity that we might set out on the table and do, right? Maybe create a little, glitter bottle to help calming down, right? And practicing a skill. Or maybe we might have some color pages. And in my district, I'm very fortunate that we have a, counseling budget. And so typically we will have some supplies that we can give our students. And I heard, kind of the PTA talking about that, right? So important to be able to, if we're talking to students about writing in a journal to express their feelings, hey, here's a journal that you can use, right? Or if we're talking to them about a book that really could maybe help them if they want to read it, right, through bibliotherapy, being able to say, hey, here's the book, right? And so I think as we continue to look at what and hear from our different stakeholders what's needed, then also making sure that we have those resources at hand, right, in the moment to be able to provide. And then, of course, I'm super excited about the 988 number, because before, as a practicing counselor, right, I had the cards that have the big 1-800 number and you give it out, and that was tough. Now it's going to be such an easier conversation with our students. And in fact, in California, we put the suicide prevention number on the back of all of our students' IDs. And so it's going to be super easy now, right, for them to remember if and when they need that additional resource.
Yeah, these are great examples of like the things that we need to do. You hear the saying, it takes a village. And I think a lot of parents, I know I certainly do, think of like the teachers and others in the school as part of that kind of bigger village. And one of the things we do talk about, particularly when we're concerned about suicide for a student or suicide risk, is, kind of changes in behavior are a big indicator, and often what the school is seeing and parents are seeing may not be the same things. And so this is a time for us to up our communication and find out what's happening. It's often, I think, when we talk, as parents talk to school professionals and vice versa, that we get a fuller picture of what's happening with our child or with the student. So I appreciate all that you were sharing, because I do think it kind of leans into this idea it takes all of us, and that all of us have a role to play supporting our students' mental health. We've talked kind of around it, but when you think about the teachers and staff at the school, I'm mindful that the last few years have been pretty stressful for them as well. And just wondering, Alma, if there's anything that comes up that your school has done that has helped support teachers. I know Shaitan, PTA does a lot of work supporting teachers, but just wondering if you could share anything, either one of you, about those kinds of initiatives.
Sure, I can start a little bit. One of the things that we did right away was, before we were going to close, and we were like, what's going on, right? And everybody had questions. And we didn't have a whole lot of answers. So we created a virtual space, and it met throughout that summer, every Monday at lunchtime, and we invited staff, and staff attended. Those that needed to attended. And then we would have a fun little raffle and, provide, delivered pizza to someone's home, one of our staff members. And then, some of them that were living on their own, that were single staff members, they're like, oh, I called my brother to come and have pizza with me. And so some connections were happening for folks that we didn't even think about that, right? But being able to gather every week, and I had people that continued to gather. And then when we came back into the building, but still not with everyone, still with social distancing guidelines, we kept that going every week. Every week, we moved it. Our district supported us in being able to do it the last half hour of our teachers' prep time. So teachers were paid to be able to participate if they chose to. And we had a group of people that did. And then at the end of last year in May, we actually met in person And so it was really cool because teachers from across the district and staff from across the district were able to come together and kind of have a conversation and connect with each other in person. And then they asked us, can you guys do this weekly? And when that question came, I realized, oh my gosh, went a lot further. People really need this. And so we're brainstorming right now. We're back and kids are back and families are back. And so definitely time is a little bit of a challenge, but the importance of being able to provide our staff with a space to ask questions, to just update one another on what's happening in their life, to worry together, I think is such an incredible opportunity that, I mentioned my superintendent was just here and I already kind of gave a little plug about, hey, I wonder what we might be able to do because this is what we're hearing from our teachers that could help them with their wellness. And then, of course, we did have some other opportunities like yoga for teachers and things like that we put in place, and a lot of online access to resources through our insurance company or through nonprofits and things like that were available to staff.
Yeah, a lot of these initiatives were put in place over the last few years in response to what was happening, but we're finding there's real value to continuing them as we go through time here, that people found great sources of support that they could use all the time.
Yeah, I think that the social networks that parents were able to do to be able to connect with one another during that, I think some of that is continuing. Being able to support, I know a lot of PTAs supported the staff, even though they were virtual learning. Some school districts, the staff had to come into the building anyway. So I know some PTAs were providing lunch for the staff or trying to bring things for the teachers to feel supported as well with being in that area. I think that PTAs have definitely supported this notion that we're together. I think this pandemic really focused on the school family partnership, right? I think it was something that's, that parents realized that, hey, it's not as easy to be a teacher as you may have thought before. They may not have thought that, but I think they got a real life lesson when they came home. And it was like, hey, you're going to be in front of this. You have to be this child's teacher as well. And I think that staff, got a greater respect for parents. I think that's the one thing that came out of this is I think that school family partnership was strengthened during this pandemic. I think that both sides saw that we need each other and we're dependent on each other in order for our babies to be successful, right? And so I think that continuing to show that we have to be together, we have to be united, we have to work together in order to make sure that our kids are successful. So all of those great things that Alma talked about are some of the things that the PTAs are doing. And I just appreciate the fact, everybody talks about the negatives of the pandemic. And I just love the fact that that's the positive out of the pandemic that I think is so amazing is that that family school partnership really was strengthened during this time.
I agree with that. And I think the school family community partnership has been strengthened throughout and as a result of the pandemic. I mean, I think what we all learned really quickly is that we can't do this alone, truly. And it really forced us to see who the resources were and the allies and who can support in it was physical care, food, medical, all of those things that we needed as a society. It forced us to find ways to make it happen for everyone. So that's been so interesting to see and witness. There are a couple of school districts I've heard about that even those community agencies that provide mental health care, the school districts now have those partnerships with them. They come to the schools. They provide either at a reduced rate, sliding rate, or free. Some school districts are paying for it, mental health care for students, families, and school staff. So again, finding ways how we can all work together to support us all.
Yeah. It's so important, these big actions and kind of the collaboration, really takes all of us. We also talk a lot at AFSP about how small actions matter too. And like, you never know kind of that extra little thing you do, how it's going to have an impact on someone's mental health, or maybe even your own mental health. I'm curious if any of you have a short story you'd want to share, or anything you'd want to share just about this idea that even small actions matter when it comes to our mental health.
I think our kids hearing us say no, when we're constantly busy, we're constantly ripping and running and constantly taking this one here and this one there. I think if they hear us say, you know what, no, I'm not in a good mood today. This isn't a great, I'm exhausted. I can't do that. And I think them seeing us say no is important because it makes them see us as not just their parent, but as a human being. Mm-hmm. And I think that's the biggest thing, that as parents, we have to make sure that we are not just their parent, that they see us as a human being as well. And so I think mirroring that of saying no, and that no is a complete sentence, and you don't need to give an explanation as to why it's no. And I think that's very important, that they see us model those things, that they see us say, hey, I'm having some anxiety about this. I'm not feeling well about this. I'm going to take this time to do this. I'm stressed. I'm going to go for a walk so that I can come back and deal with that. Those small things, I think, make a big impact on mental health, on having healthy mental health discussions, on having positive mental health discussions. So it's not always negative. And so hopefully we can remove the stigma around mental health, so that it's not a negative, but actually a positive when people think or hear the word mental health.
It's a great point. I often think about some of the small actions is really just taking that extra kind of step to engage a child around problem solving or around kind of coping. And, I have a teenager in the house, and, it's sometimes it's easy to just say, well, it's this way or that way. But really what we want to do is help them become kind of emerging adults with a set of skills to solve problems and to, weigh consequences, to have healthy boundaries, all of those things. And I think even just taking an extra few minutes, and we're all busy, to say, well, what do you think about that? And what do you think would happen if you did this versus this? And really kind of exercising that muscle with them around coping and problem solving. I think it makes a big difference. Well, we have a few minutes left. I want to give you all the opportunity if there's anything we didn't talk about that you'd like to share. And then I thought maybe we'd close on a note of how we all take care of our own mental health and model that for students. So first, anything we didn't talk about that you'd like to share, either about your organizations or about this topic?
I would love just to add one thing. I mean, we've touched on it throughout the conversation, but as we think about what school staff entails, not only the teachers in the classroom and the student support personnel, and as we think about those who need to be part of the conversation and have the necessary tools and resources, we need to remember to also keep in mind the school bus driver, the custodian, the coaches, the cafeteria staff, everyone who interacts with a student. We all need the same information. We all need to know what the process is to, if you have a concern about a student, what you need to do in your school to ensure that that student gets the attention and support they need.
Excellent.
I'll add that PTA Healthy Minds program, it's pta.org/healthy minds. A lot of great resources for families and schools. It's topic specific. So if you want to deal with, you say, hey, I think my child has depression. There's a depression test that's on there. There's tools to help with that. There's tools about dealing with school shootings or community violence in your school, or how to talk to your child about the death of someone else. I think there's a lot of tools there that will help parents. There's also a resource where they can link to other organizations that may help them through whatever they may be going through at that point in time. There's videos there. There's snippets that they can begin to have these conversations with their family. There's podcasts there about Healthy Minds. It's like a one-stop shop for families to be able to just say, hey, I'm having this issue. How do I go talk about it? How do I start the conversation? A lot of great resources there. So pta.org/healthy minds.
Terrific. And Jill, ASCA's website for those who might be listening?
Absolutely. It is schoolcounselor.org.
Terrific. I know both your websites have excellent resources. I've gone on both of them and learned a lot for myself as a parent and as somebody working in mental health as well. Alma, anything that you wanted to add?
Yeah, well, I'll just echo that. I go to ASCA's website all of the time. I go to the PTA website all of the time because they do have these ready to use resources. So when a situation comes up, maybe there's a death in the staff community and you want to know how to write that letter, right? And there's ready to use tools. Or maybe I'm going to go over to the PTA because I'm going to have a meeting and I know some questions might come up about how do families talk to their young ones about this, right? And they're going to have those ready to use resources. So like I mentioned earlier, we share these flyers with all kinds of resources, but we also review the information that's there. So parents kind of know what's there and it's not just a laundry list of things. And then you made me think of something during highlighting using our young people. So in my school and in schools throughout the United States, I know there is something called the Bionic Team, and it stands for Believe It or Not, I Care. And it's young people supporting other young people during trying times, during difficult times. And it's something that I learned about years ago that I brought into our school community. But during the pandemic, and now as we return, it's that group of young people who have some training and knowledge about how to express empathy towards someone who's going through a difficult situation, right? And how important it is, those small things that we do, right? Jill, I noticed that you weren't here yesterday. Is everything okay, right? Or Doreen, I noticed, you haven't been doing your homework, right? That doesn't take the school counselor. That takes anybody in the building, a peer or an adult. And the more of that we can do, then we can bring things up to the adults that can help us triage what additional supports might be needed. And so I think it's just important to remember that regardless of our title, as the parent, as the school counselor, as the bus driver, we all really do have a role to play in mental health.
I couldn't have said that better. 100% agree. And, I think that the thing I would add to that too is that I think helping their peers understand that, you can always come to me as an adult with a concern about your own mental health or about a friend's mental health. And it's not going to result in some punitive response or something that's going to feel problematic. We want them to be allies, right? We want them to help us identify when students are in trouble, and we want to be able to support them when they do. So we'll do a last minute kind of rapid round here. Something you do to model good kind of mental health or mental health coping. I'll start by sharing two of mine. I'm kind of really, sleep is something I pay a lot of attention to in terms of structure and all of that. And I've really tried to continue with that through my adult life because everything goes better when you've slept well. And the second I would add is that with my kids, I'm always talking to them about trying to separate out what you can control from what you can't. And that as part of our kind of going into the school year, there's going to be lots of things that feel out of our control but there are some things that are within our control, right? Like how prepared we bring our supplies to class, that these are the things we can focus on and do to make it easier for us and to kind of make a less stressful experience. So that those are the two things, sleep and separating out what I can control from what I can't. Shaitan, you want to go next?
Yeah, something popped in my head and then it just went out. But one of the things that I've been focusing on lately with my own mental health is prioritizing like my boundaries, like being very clear about this is my boundary. I'm not going to let you cross it, because that's the thing. I think we think a lot about boundaries as we're asking people not to cross them. And it's not that, it's this is a boundary. I'm not going to let you cross it. So I've been really focused on that part of it and saying no. I think that that's one thing. And I remember it now, is I've started to when I'm calling my friends or family or whoever and I'm having a bad day, I'm learning now to say, are you in a good space to hear this? Let's say, let me not just dump on you, but are you in a good space to hear? I need to vent. And so, given that allowance that I need to respect the fact that this may not be a good time for you. So let me check before I go into my tirade about, whatever happened that day. So those are 3 things that I'm really focusing on now for my mental health and mirroring that to the young people around me.
Oh my gosh, I love what you just said about asking if they're in a good space. It's one of the things one of my own children have started doing with me and with her siblings and family, and that was just so new to me. And I was like, oh, and she's like, I can't. And she'll say, I can't hear that right now, and I'm like, okay. So she's been modeling that for me. And then the other thing I do that started with the pandemic is walking. It's a community I hadn't lived in too long when the pandemic happened, and I've continuing to walk and explore and find lovely things about the place where I live. And so that's something I've continued to do that's good for me.
Mm-hmm. Yeah, I think for me, it's a couple of things too. One is not necessarily saying no. For some of us, that's hard, but finding a way to let people know what you need. And so in my journey as school counselor of the year, and Jill knows this, I do say, like, I need a good night's sleep before I go somewhere. I cannot do the red eye, and I need a place where I can have breakfast right after. I need a good night's sleep and I need breakfast. So those 2 things, Doreen. And then the second is finding the joy in the job.
Yes.
I think that there's, the list of self-care that we can do. And I like a massage, like everyone probably on this call, right? Like those things are important and they matter, but really it's in the day-to-day work, right? Finding the good in what I do and in the services that I might provide, and being joyful and starting there, because then you see the joy in everything. And sure, problems will come up, but you know that you can address them and that you could be part of the solution. So I think that's an important thing.
Such terrific feedback from all of you. I want to thank the 3 of you for joining us today. This has been such an important conversation for me as a parent, but I think for many that may be listening or watching as we head into this season, really giving us lots of things to remember, but also lots of tips and things to help us get through back to school in a way that's going to support our mental health. So thank you. It's been a pleasure to have you on the Facebook Live today. And for those of you that have not checked out AFSP, we are the American Foundation for Suicide Prevention. We have lots of K-12 education programs and other resources, and you can learn more by going to afsp.org. Thank you, Jill, Shaitan, and Alma. It's been a pleasure to have you with us today.
Thank you.
Thank you.
Thank you.